Yes. Welcome again today. A very nice day. A nice day with cold here in Kenya, straight away from Kenya. Very cold day with sun and dust. What do I say, man? We are saying welcome to the platform. We're talking about mental health. Is mental health is everything because all the problem starts from your brain, starts from here. And when they start from the brain, what do you say? We treat them. We look at them and we treat them again. Now, yesterday we talked about traumas, and traumas are cate- categorized in specific ways and general ways. Several types of traumas that we talked about, and you saw how emotional trauma can be bad. I usually say emotional trauma is the worst because now you cannot treat that trauma with a painkiller. There is a musician, I think, I don't know if he's a South Sudan or from Tanzania. Yes, a Tanzanian musician or a Burundi Rwandan musician who said he sang a song, maumivu ya penzi, mtu ajikuni, mala jikandi na maji, na hakuna upasuaji. And then he said again, kama ni makosa nimewaifanya. This guy was saying, uh, pain from the heart, maumivu ya penzi, pain of love, mtu ajikuni mara jikandi na maji. Someone cannot put something like a muscle ache to be okay, and there is no surgery. That's why he sings hakuna upasuaji, and then in front this person apologizes, kama ni makosa nimewaifanya, like if there is a mistake I've done, then there is a female singer who comes in and say, nieleze. You see, kama ni makosa nimewaifanya, na kama kuna kitu ninaweza weka upatanishi. Now, it starts from something, a situation, to a big thing that comes in. Now, you see, there are some things that we look at and ignore. Trauma related issues. We look at trauma related issues and we ignore these issues because, these are issues that we should take control of. These are issues that we should look at and see how we can control them. Depression starts from an event that affects you not physically but mentally. And then you start thinking, you think, and then because your brain is hit by something, what happens? You start feeling effects physically. Why? Because while your brain is overworking, some neurotransmitters are being released, some are being deprived, and some are reducing. So your brain is, I say, everyone's brain is the CPU, sorry, CPU, Central Processing Unit. Like in a computer, if the CPU is destroyed, the whole computer is not working. So you see, an event starts, be it personal or social event, starts from somewhere and then it leads to uh, a bigger event inside you that continues for a while. So the better thing to do when you come across some issues in life, what you should do is you stop or you avoid issues that you see These ones will lead me to somewhere that will not be okay. You see, life events that you know will forever be in your head, you should avoid them. Hmm? We saw like we saw a person gets into a relationship. Let me give a relationship now, because most of traumas, most of the middle aged are really troubled by relationships. Someone gets into a relationship, then what happens? This person starts to have some traumatic events. You expected this person to be the perfect person that you have, but you got into a relationship and you are not getting what you wanted. Simply because before you got into the relationship, you avoided the red flags. Or you got into the relationship because of some circumstances. Hmm? Parents get children, they grow up, these children grow up in environment, an environment that can lead this child to be having some traumas, developmental traumas, as we talked yesterday, developmental traumas. This child becomes an adult after 18 years, starts to talk, to express him or herself to the parents. But because the parents don't want to listen to an 18-year-old or the guardian, what happens? This person starts to have a denial behavior, hmm, avoidance behavior, and masks that behavior with a bottle of alcohol or gets to drugs. The other thing is this person can withdraw from society and from the right people and join the other people who are not good. The other thing is this person can live in fear because now he's exposed to people that he is exposed to life, not people, to life that is not helping him or her. You see, now, yes, very important when you talk about such life events. Today, we are talking about something that is very important. Hmm? How to manage secondary trauma. Secondary trauma, and what is secondary trauma? Secondary trauma, this is secondary trauma when it comes to mental health. Hmm? What is secondary trauma? You see, this is second. You, as the person who is facilitating or helping people, you are traumatized because of the event that you are trying to help. This is what we call secondary. You are not the primary problem. You get it? You are the secondary. Hmm? So if I can talk about secondary trauma, this is what I can say about secondary trauma. Secondary trauma, also called secondary traumatic stress event, secondary traumatic stress event, or vicious trauma, refers to the emotional and psychological impact experienced by individuals who are indirect exposed to trauma through close contact with those who have directly experienced it. It is often affect this one, people that this can affect: caregivers, health professionals, therapists, social workers, very important, emergency providers, and family members of trauma survivors. You see, if you are not the person, you are not the primary pro- problem that you're facing. You are not the primary person affected. You're the secondary. I will repeat. Hmm? This is refers to the emotional and psychological impact experienced by individuals who are indirectly exposed to trauma through close contact with those who have directly experienced it. And the people who are exposed to this secondary trauma are caregivers. caregivers to people that have problems, medical problems, mental problems, health professionals, me included, me included, therapists. You see, as you give therapy, you are eating that again. You are swallowing and ingesting it. Social workers, because social workers are the first at hand at the problem. And you know, since in mental health are very bad, imagine you're being called to a house that people are fighting, relatives are fighting, a mother and a father are fighting. You have to go there, sort a problem. Now, today we are dealing with these people, and this is not the only problem. We'll talk again about sexual traumas. Yeah, the song of the day today is the song of the day today is what I've sung when I started by Kidum. Hmm? Maumivu ya penzi, mtu ajikuni, wala ajikandi na maji, na hakuna upasuaji. Yeah, yeah. The pain of mental torture. There is no surgery or a painkiller. Now we continue. We are in secondary trauma related issues. Emergency responders are also included. Family members are included of the survivor. Now, what is secondary trauma? I've just named people that get this problem. When we finish this, we will go to sexual traumas. Sexual traumas are so important, and they cover a wide range, including to people that are married. We are going to see what are sexual traumas. Yes. Now, a secondary traumatic stress is this emotional duress that results when an individual hears about the first-hand trauma experience of another. Just imagine secondary traumatic event, emotional duress. When a person comes to you, when you are trying to guide someone and you're trying to help someone, be very careful not to be a secondary person to get the effects of what you are trying to help. Secondary traumatic stress, emotional duress that results when an individual hears about the first-hand trauma effects of another. You start being empathetic, and then you start feeling what that person is feeling. You see, that is trauma. It is part of trauma. You are sharing the trauma with that person, be it a relative, a friend, or what you are sharing. Yeah? And then we have vicious trauma. Vicious. All these are definitions of secondary trauma. As we help people, we should know how to manage ourselves, not to get traumatized again. You get it? Now, many people help people outside here, and then they find themselves in a problem, trauma event. Then you start having depression because you got yourself into something that was already boiling. Now you are the part of the meat that is boiling. Now, this is secondary trauma. The second one we call vicious trauma, a process of change that occurs over time, as help us internalize stories of trauma and begin to mirror the pain of those serving it. Imagine you've tried to help a person, the person healed some times ago, but where you go, you start feeling the pain even after months. I wish I wish, I wish that could not happen. You see, you help a person, but you've moved on, but it is becoming traumatizing. And then you start having problems. Let me say, a man who was domestically abused by a woman, or a woman who was domestically abused by a man, and then someone came and helped them, but they separated, and now he was sharing the problem of the woman. So after years, this woman who tried to help carries the burden in her. And after years, this woman, every time he sees dark pen, he remembers the story. So He's carried the traumatic event of that woman in her, and it's affecting her after years. You get it? Hmm? These are problems that we face when you are the secondary person. Caregivers, health professional, therapists, social workers, emergency responders, family members too. They have this problem. So, vicious trauma is carried out after years. And then secondary traumatic events is emotional duress that results when an individual hears about first that event. You get it? Let's see. What are the causes of and the source? Yes, Dolin Small. Good morning from Jamaica. Welcome again. It's evening here in Africa, Kenya. We are doing good. We are talking about secondary trauma. When you're trying to help someone but you get affected that afterwards more than that person. You see. And I've given a song of the day by a person called Kidu. He sang, this person said, uh, pain of emotions cannot be treated by paracetamol or taken to theater as surgery to remove it. You can only heal over time. Yes. Now let's see the causes and sources of secondary trauma. Now, this is how secondary trauma comes in. You get it? If you have experience, we will see, but we will know how to manage it slowly by slowly. Now, causes of secondary trauma. Listening to traumatic stories repeatedly. Counselors and therapists. When a person is a counselor and he has many clients, he'll always, a person has a problem with the brother, this person will come. Afternoon Sana, Sanam Halaba. I hope I sounded that correctly. Welcome to the platform. We are talking about Sana Benjamin. Yes, welcome, welcome, welcome. We are talking about trauma that is affected to the secondary person. Hmm? The person, when you go to help but you find yourself you're the person who is traumatized. Who are this person and what are what are the causes of this? The first person I'll name is counselors and therapists. They listen to problems of other people for so long, for long, many causes, and when they go to their homes, they start internalizing. Mary Butler Britton, I'm here blessing Dr. One Love from Jamaica. Mary Butler, I swear, my first destination when I want a vacation, I've not gone for a vacation for 10 years. Well, the first drop will be Jamaica. I want to listen to reggae directly from the authors. I love reggae, man. Yes, my Tennessee Sky in the platform. Today we are talking about secondary trauma. Trauma inflicted to a person who is trying to help. That is what we are talking about. Imagine you are going to help and then you find yourself, you're the one who is holding the trauma and being affected more than the person. Personality A, perfectionist. If you know you are a perfectionist, this is for you. You will always carry burden for others. Now, the people that are affected to these problems, what are the people, the sources and the causes? We started by one, listening to traumatic events and stories. And you see, witnessing the aftermath of trauma. After an emergency room staff, forensic examiners. You see, when people are in a hospital and they are responding to an accident, and then after accident, when you go home, you start thinking. You see, medics are mentally affected at times. Don't ask some medics why they take a lot of alcohol. If you see your brother, your sister, your uncle, your what, your relative is in the medical field, and this person is always smoking and taking alcohol, know that that person is a medic, but that medic also needs help. Because this person is experiencing trauma that he or she has carried from whatever he usually see or she usually see. Imagine, you see, people work in the morgues, they do autopsies, and they see bodies that are traumatized. You see, that is trauma that is carried. Hmm? If you don't know how to manage yourself, you will find yourself traumatized rather than the family or the person who is injured. You get it? Empathetic manage, engagement with the trauma patients or survivors. Hmm? When someone has been injured, someone has undergone continuous stress from a relationship, and you are the mediator. You get it? Today I'm talking about people who are trying to help, because I've seen many people that are helping, they find themselves entangled to things and they don't know how to manage. Because you help and you find yourself, you're the one who is suffering most than the person you are trying to help. So that is what we are dealing with today. And then after this topic, we'll talk about sexual traumas. Yes, we are going on. That is the empathetic engagement with trauma survivors. That is the third one. The fourth one, long term exposure to suffering or abuse. Hey, that one is bad. If let me just say this because it's in my heart. If you ever get to a relationship because you needed something, if you ever get to a relationship because you needed something, you got into a relationship because you wanted to live a good life, a soft life. Two, you are avoiding something somewhere, or life burden has become big. Hmm? Or five, there is something that you are hiding inside you that you cannot say, but this person is the only person who knows. Blackmail. Just know you are digging a traumatizing event that will never come out. Because now, if you come, you get it. Let me use just love relationship because it's the common one. You get into a love relationship with someone, and then because this someone is financially stable, but you don't love this someone, you stay for some time, you are enjoying, you got from poverty and now you're enjoying. You see, you will reach a place whereby you are comfortable. You don't want to engage to this person as a lover, and that is where now problems will begin. It's better you wait, get your real partner, someone you love. Yeah. So if I speak like that and the generation right now listens to me, I will say this person is nuts. You get it? Short fixes are always problems in future, and people get into relationships nowadays to cover out from something. You get it? Don't use your finances to get into. Benjamin the wise guy. I was told that why there's no secret is because some people problems are heavier to carry for long. So the psychologist also is tough to them. I imagine how they cope. Yes, Sana. This is what I'm talking about, secondary trauma. You get it? Secondary trauma. Sana has just told us there. You see? So, what I'd advise is instead of giving psychologists and counselor problems, you rather stay step by step. Now, let's continue. The fifth person, the fifth thing that will be a source of secondary trauma. Work in high stress of emotional charged environment. Work in high stress. Child protection services disaster. You see, when you go to children protection areas, you may look at some people, you may look at some people and you'll be depressed. You may look at some children and hear the stories. When you go to your home, you'll be depressed, and you'll be so caring to your children and destroy them, because there are some things when you are too caring to your children again, it's a problem. You get it? Those are the sources of it. And there are some professionals and some areas that we really need to see. These are the areas that If you have a relative, if you have someone who is in this profession or this area, you should try to help. You get it? Here we are friends everywhere. As I speak right now, I know someone is thinking of someone who tried to help and is always getting problems right, left, and center, and having traumatic events, even forgetting himself that his relationships and his life is going bad. You get it? Forgetting his relationship, trying to help and following up for long, and then it turns traumatic. If you have someone as a nurse and a doctor, profession in medical field, especially in the ICU and paramedics in the emergency department, if your relative is working there, always be on the watch out. Be as a good sister, be as a good brother. Always ask this person, are you okay? How was your day? Can I do something to you, sweetheart? Can I do something to you, brother? These things help serotonin levels in your brain to rise up. And dopamine to rise up. This person gains and forgets. He knows now I'm in the environment of my family. Second, Sanas just told us about the second one. Psychologists, counselors, and psychiatrists. My friend, if you have ever gone to a psych ward or a psych department, you will know what I'm talking about. Handling people that are aggressive and are not in the real world is traumatic, even at looking at them. If you are not trained the first day when you go there, you will not be comfortable. You will not even stay there. So, if you have a psychologist in your family, if you have a counselor in your family or a psychiatrist, it's a profession. This person must work. But always take this person out. Talk to this person. Distract this person, but not with alcohol and drugs. No, psychologically, be as a relative, be as a friend to this person. You get it? This is very important. Police officers and correctional staffs. Police. Everywhere in the world, police are hated. This is just a profession, and those people go to work and they are trying to protect the environment. Although there are some people in the police department that are raw, corrupt. But you see, the Marge is in the house. Welcome, Marge. Welcome. We're talking about secondary traumas, traumas that are carried on after. You have explained. Let me continue at the professions. You see, police officers work very hard. You imagine shifts at night and then sometimes are working away from the family. Working away from the family and they are trying to protect the life of, you get it? By protecting, they are being hated. By being by by being caught on the scenes of aggressiveness, because you'll get people with guns and you'll try to fight. You'll see dead bodies. You'll go and separate people that are being aggressive. You will be called names. Everywhere we walk in the world, we see people shout to police. And if you have a relative who is a police officer, please celebrate that person. But that person, if your police officer is a rogue police, know what to do as a family. But this is they are commonly affected. They are really commonly affected by secondary trauma. Because one, police officers don't have time. They stay away from their homes. Here in Kenya, where we stay, you see, they stay away from their home, and we see them undergoing so many issues that at times we look at them, and some you have seen, we've got so many life losses by suicide, and sometimes life losses of police at the scene of 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 work, because their scene of work is going to help to protect life, to solve disputes. You get it? And then we have firefighters and paramedics. Paramedics are worse. because when there is firefighting, so there are sometimes there is losses, and when there is paramedics going to an accident scenes, there are some pictures at times even in the media they cannot be uploaded, but you see paramedics are the first at hand. Doctors that have trained on accident and emergency are mostly affected. Nurses that are trained, doctor's assistant, clinical officers, and there are this called nutritionists and public health officers. Please pray for them when you know you have these people in your family. Social workers and case managers, social workers. In our society here in Kenya, we have some women or men that go to houses to see sick people. The environment of where these people go. Yes, police job is the most traumatic and strenuous. Very important. Very true. Very true, Sana. So let me see. When social workers and case managers, remember, if there is a you have a question, important, you just ask as we continue. Just ask. Okay. You go to this is for social workers. Social workers go to an environment to see a person at home, an elderly person that is being neglected by the society. You reach there, you find that this person is immobile, he's not eaten for some time. The environment, maybe he lives in a wood thatched house. You see, as a good person, you will not just sit there and see this is okay. You will go home feeling and seeing what you saw firsthand from that. You get it? So imagine emergency and traumatizing events in social workers, it is in a high rate. And even managers, those managers that go hand to hand after the courts have released a person and they are trying to follow up. You see, those people that are on patrol being followed by case managers. Mm, You may find someone overdrugged with dope. You even see the situation and you cry. You get home, you start having those events, revising them. Journalists and traumatic journalists covering traumatic events. Journalists and traumatic events. Everywhere there is a demonstration, everywhere there is war, you will see their journalists. I know all these people that I'm speaking about here, some of them are our relatives. It is very important to know, hmm, teachers or caregivers of traumatized children. Children, if do you have a relative that works in a disabled school? The first time I went to a disabled school, I could not talk. And you see, I'm a medic. I did my case and I left. You see, I did my case and I left because it is so sudden. Sometimes you can ask God, why is this? But you see, it is life. And those people who work there, they ensure that these children are okay. Caregivers there, the teachers that try to help those people, they make sure they're okay. In that, when these people go to their homes, they start feeling there is a problem with me. But let's see, what are the signs and symptoms? What should you look so that you may know this is my relative, but I think there is a problem. You don't just say, my brother is a doctor, he's okay, he knows how to handle. My sister is a police officer, he knows how to handle these things. They are trained. My friend, training, sometimes it's training, but the real things in ground is different. The more you are exposed to this, the more you start forgetting you are trained because you are human. But you, as the second person from that person, we have relatives. And even as I speak right like this, and you are listening and you are watching this video, I know we have relatives that are undergoing these issues and are with us, and they always are affected. Now, these are the signs and symptoms that your relative may be undergoing secondary trauma. You have seen we are losing so many people from jobs. Someone just stops from going at work. If you ask this person why, this person will tell you that I just felt I don't want that job. I rather stay at home. Or that a person starts becoming an alcoholic. Don't ask yourself why. It's because the environment neglected the signs and symptoms. The environment did not look at that person, and so this person is suffering from secondary trauma. You get it? Of the place of work that he's going always. Now, emotional symptoms. What are emotional symptoms that you will see to this kind of people? Anxiety and sadness. You will always see this person is anxious and sometimes sad. Hmm? Irritable and angered. You know, when you are suffering inside your heart, and there is nothing you can do, and you've carried that stress from work, and you're thinking on how you can help. You're thinking on how you can go to school and help that child to walk well and to talk, not to struggle from the trauma that is happening. Hmm? Down syndrome children. What do? Sometimes you have anger with yourself. So people talk to you and you're just generally angered. You see? Then sadness comes in. Emotional numbness. There are some people who doesn't have emotions. You are a partner to this. You are a partner to this person. You are trying all the romance. You take this person out, candlelight dinner, and this person is there looking at you at like even sense. This person is looking at me at why are we wasting this time? You see, find out why. Is there a problem at work, or is this person carrying secondary trauma? Because maybe if there is no positive or active issue that is going on, this person may be carrying secondary trauma. Hmm? And then there is something called guilty or helplessness. This person is always guilty and sometimes feels there's nothing I can do to this world. And that's why you at times feel that police officers are not emotional because of that. Hmm? Or some people who work in the forces. You people always say those people have no emotions. It's because of the secondary traumas. The secondary traumas affects them a lot, and they become irritable and angered. They are emotionally numb, and they are guilty always, and they have helplessness and sad at times. Integration to the society. You see, or when armies come to from a war, they don't just come home and then they are hugging everyone, and then at I'm home, daddy and mommy or nanny. Ah, no, they have to take time whereby the government sets a time of integration to the society. That is why, unfortunately, to many professionals, this is not happen, does not happen. Now, what kind of behaviors will you look and you see there is a problem? We have just come from emotional symptoms. Now, social withdrawal. This person will want to stay alone every time, calling him or herself introvert. I'm an introvert. Avoidance of trauma stories. When you start saying a story that is related to what this person has been facing, you'll see this person telling you, "Ah, stop that story. It's not necessary." Or this person will tell you, let me come. Hmm? Avoiding those stories. Increased substance use. Very prevalent. This is highly prevalent. People get into drugs to acutely, short term, forget about those stories. But when the intoxication is gone, they are back to sadness. You guess? overworking or burnout. Some people you will see them overworking. They are always working. Hmm? These people are always working. And they'll tell you work reduces my stress. Just know this person has secondary trauma. It's good not to avoid these things because mental health is an important thing in the society. Now I'm opening out up your eyes to look at your relative or your sister or that uncle of yours, that celebrated person in the village that you were looking at, but now you are not looking at that person again because this person has secondary trauma. Hmm? And there is, after emotional symptoms and behavioral symptoms, there is this thing that comes in. Your body must suffer physically. What are the symptoms? What are the symptoms that will show you that this person is suffering physically? Physical symptoms like headache and fatigue, always tired because of thinking, depression, and always overworking. And then we have sleep disturbance. Have you ever had someone that when you go to bed with, you'll find that person has woken up watching TV, even when this person is on leave? Or you've just gone to a vacation and this person has taken leave from work and he doesn't have sleep. You go with your partner, you make love, everything is okay. After that, you are totally asleep. You wake up at midnight, you find this person watching TV or seated just looking at the ceiling board. You see, sleep disturbance, that is a physical disturbance. Physical. And when you have sleep disturbance, there is this thing that will come in. People that complain of stomach upset always, gastritis, gastroenteritis always. This person has been at work so well, doing work. When he comes home, he eats, sleeps, go to work. But at times when this person is at home or taking leave, you have cooked a good food, the meal is totally perfect. This person has eaten, is at home or you are in vacation, but is always having a diarrhea and gas and stomach upsets. This is a sign telling you that this person is undergoing secondary trauma. You start complaining that nowadays you are not cooking good food. Search your soul, search yourself, ask yourself, why am I having stomach upsets always? And I've been eating the same food that my wife, my husband has been cooking. You are undergoing secondary trauma, my friend. You cannot be having gastroenteritis and gastritis always. We do our ultrasound, you are always seeing gastritis. We do our enema x-ray, you don't have ulcers. Check about your mental stability, my friend. Muscle tension, muscle cramping always related to gastroenteritis, gastric issues. When I'm talking about gastrointestinal problems, I'm talking about problems of the stomach. You see, people that are perfectionists and people that are undergoing secondary trauma always have gastroenteritis, gastritis, abdominal upset all the time because of imbalance of a hormone called pepsin in the stomach. Eh? So these are the symptoms that you should look at when you are having this kind of profession and these people are helping and you're seeing these things are facing you directly in your home. As doctors, we are trained to help people, but at times we forget and we start having secondary traumas. And this leads us to many complications medically. Many doctors get diabetes, many doctors get hypertension, many police officers get hypertension and diabetes secondary to secondary traumas. It is good to protect your relative from all these things that I'm saying. because you may end up having the same problems you yourself. Because if you don't protect your relative, what will happen? You will be the next, and you will suffer the secondary trauma because you will be carrying the burden of your relative. You see that? It is important to take care of them. There are some cognitive symptoms that you should look at. Cognitive, we understand when we talk about cognitive symptoms, is we are talking about symptoms that are related to what? The brain. What are the cognitive symptoms that we should look at our society? Because now, if you don't take care of these people, you're not taking care of your uncle, your brother, your son, your relative, you are the next. Secondary trauma will start having you. So take care of that person so that you will not be the next. A very good person, in a person who was the IQ was okay, a person who always thought straight, you start feeling that this person has confusion. Sometimes this person has poor concentration. These are cognitive symptoms. Memory problems. You start asking a person, we were to go today at certain place. Oh, I forgot. Person who had clear, good memory. Hmm? Please don't go without liking the video. Just like and share. Let's bring all the people to the platform. Let's talk. Let's help each other. Because as I help you, you will help your brother. And your brother will be helped, and you will not have secondary traumas that will be carried away along to the generation. You get it? I've said memory problems. Hmm? Cyanism or loss of hope. Hmm? Loss of hope is called cyanism. Some people, when they are cut off from jobs, they lose hope in life. You start carrying the burden of that person, thinking deep. See, that is secondary trauma. Hmm? Loss of hope. This person, there are some people, they will not go to search for another job. They will not do something else to bring something in. And this is where men go wrong at times. You get a man has lost his job. Both of them were working with the wife. Now the man becomes dependent to the wife. It brings problems in the family. Because now the wife is taking care of the family plus this man, which she was not used to. It becomes a very big burden. What happens? Wrangles. Wrangles starts to come in. And if wrangle starts to come in, what happens? Secondary trauma comes in again. The mother to this person, this guy, starts to suffer the problem. Remember, maybe the guy was the breadwinner to the family. The children starts to suffer the same. The guy becomes hypertensive and diabetes. The woman traumatized because he cannot hold on, but the man starts to say, I took care of you when you had no job. You see how things are triangling and coming out, inside, out. Hmm? This is secondary trauma. You lose hope, cognitive symptom, intrusive thoughts and images. You know, when you lose hope, you start having bad ideas. Let me throw myself from a cliff. Let me leave my family because I cannot be continue to be insulted by my wife like this in front of my kids. Where are you going? That is your family. Intrusive thoughts, images of people that have died because of holding this. You see, these are things that are happening, and I've talked about all the symptoms. I've explained the symptoms of how you can know this person is having secondary trauma. I've talked about emotional symptoms, behavioral symptoms, physical symptoms, and cognitive symptoms. In emotional symptoms, I've said anxiety and sadness, irritability and anger, emotional numbness, and guilt or helplessness. Behavior, social withdrawal from the social groups and society, avoidance of trauma stories, increased substance use and alcohol, overworking and burnout. That is behavioral. And then we have physical symptoms like headache and fatigue, sleep disturbances, gastrointestinal issues, and muscle tension. And then cognitive symptoms like confusion, poor concentration, memory loss, cynicism or loss of hope, intrusive thoughts and images, cognitive symptoms. Evelyn Minage, my sister. Evelyn Minage comes from the same region that I come from. Big up, sis. Big. I will. One day I'll come home and I'll see you. Hmm? Evelyn Minage, we are talking about secondary trauma. Big up all the time. Yes, we go on the primary. You should know how to differentiate between primary and secondary traumas. How do we differentiate these things? How do we say that this is not secondary trauma and this is primary trauma? The source. The source is the first thing. Direct exposure to traumatic event. That is primary trauma. Marge, yes. If you have a question, please raise it. If you have an experience, please tell us. Talking is healing. Hmm? That's why I usually say when I get into something, I deal with it one on one and I leave and go. I've already talked out and dealt with that thing. I don't want to hold traumas in my head. No. Now, the source, primary trauma is the source of the trauma, the source of the trauma. And then we have another one. We have affected individuals. Who is the affected individuals in this trauma? Survivors. Survivors are the primary source. Onset. How did it start? Immediate or delayed? This is in primary trauma. Hmm? Risk environment. Those people involved in wars, violence, and abuse. You see, what I've said relates to primary trauma. And then we go to secondary. Listen carefully to secondary. You may find a very big difference between primary and secondary. Now, this is secondary trauma. Indirect exposure via other traumas. Like psychologists, we have gone through those indirect. You have seen, like psychologists, you have seen helpers or those close to survivors, people that are taking care of them and relatives. This is now secondary trauma, the topic of the day. Gradual or repeated exposure to helping or to seeing whatever that is happening. And then counseling, caregivers, and emergency at work. Hmm? Risk of environment. Please go, Dorothy. Yes, faster. Usaenda unaniambia. Acha kuniambia, kimbia kwa nini, niko kwa nini. Just a minute, guys. Just a minute. Just a minute. I search for something. Yeah. Just a minute. A minute. I search for something. Yes, sorry about that. I had to take care of something. I'm back now. We have talked about the differences between primary and secondary sources of primary and secondary source, and we have seen how to differentiate this. We have seen how to differentiate traumas of life. I know now if someone is listening to this and remembering whatever he or she saw happening to a brother and uncle, mostly those people that withdraw from work and they cannot explain why this person just withdrew from work. You see, there are some things that you really wonder why this person was sane and doing good, but this person has just withdrew from work and he cannot explain why. Now you know why. Secondary traumas. And that's why we want to deal with secondary traumas and try to know how to manage secondary traumas. Now, we continue on secondary traumas. There's risk factors of secondary traumas. We have differentiated primary and secondary so that we be at par. The first topic. Now, what are the risk factors of this? High empathy without proper emotional boundaries. You go to help people and you are so empathetic. Hmm? You remember us talking about the word empathy. Sometimes people go and carry crosses for some other people. You get into the situation and you find yourself, you are part of the problem. You see, you are part of that thing. Empathy. Let me explain empathy a bit. Empathy is the ability to understand and share the feelings, thoughts, and experience of another person. You understand the word empathy. The word empathy, you should be very careful with the word empathy. Listen again. It's the ability to understand and share feelings, thoughts, and experience of another person. It involves putting yourself in someone else's shoes and feeling, hey, feeling what they are feeling without necessarily experiencing it yourself. You see, empathy, that means you are not feeling it yourself, but in another hand, you are feeling yourself. It is getting you traumatized. It is getting you traumatized. My friend, my sister, when you are empathetic and you are helping someone, be very careful. And you remember we said about empathy, we have cognitive empathy, emotional empathy, and compassionate empathy. Yeah? Understanding someone's thoughts and mental state is cognitive empathy. Emotional empathy, feeling the emotions of another people. Hey, secondary trauma. You're trying to help, but now you're getting into that person's shoes. Compassionate empathy, not only understanding and feeling the persons for someone, but also being involved in help, compassionate. So I know of my friend who is like this. And right now is a lot of problems. People are fighting this person. You get it? Hmm? Now we continue. We continue on our topic of the day, hmm, of traumas, the risk factors of traumas, lack of support or supervision. You don't have support. The people that you are helping, you are the only one carrying the cross, in your family. You are the one who was successful in your family, and all the burdens are in you. My friend, you will undergo secondary trauma. I've seen people that have carried the burden for their families and relatives, and they are having it rough because of secondary trauma. You assisted everyone, and not everyone is near you when you have a problem. Emotionally, you will be torn. When you're trying to assist, know who you are assisting and who you are following up on. Because it is good to assist. Let me talk openly. It's good to assist. But if you are assisting and you find yourself at the brink of damage, if you are assisting someone and you'll come to be torn in future, what does that mean? Would you rather leave assisting? Very confusing, right? It's very confusing. But now, what can we do? Let's continue. Let's continue. Excessive workload or caseload. When you go to places of work and you have an excessive workload, you know you are not the one who is making the profits. The other person that you're working on is the one who is having the profits. But you, where are you going? What are you doing? Handling the trauma, secondary trauma. Poor coping mechanism. A place you are trying to cope and you are not getting into, you are not assimilated into that because it's not part of you. You go to some jobs that are not worth, and you try to cope and you are having all the traumas. Those works, those jobs that people go to, they are trying to work, they are trying to cope, but they cannot. Negative jobs, you understand? There are some jobs nowadays that people do that they call them jobs. Let me put them in quotes. You can name them. They call them jobs, but you know they are negative jobs because this person is there working and trying to say that I'm working to but you understand so much that this is not a job. How will my family say when I'm doing this work? Secondary trauma comes in. That reminds me, when your relatives have gone abroad or traveled away from where you are, do you really find out what your relative is undergoing? Do you really try to find out what this person is doing for a living? It's very important. Ladies from Africa go to abroad and Asian countries and other places to work. They get traumatizing events. When they come home, they cannot hold it anymore. They become mentally disturbed. Your daughter, your son went abroad or went somewhere to work in an Asian country or somewhere, or a person came to Africa to work, but when that person goes back home, this person is into alcohol, he's into behaviors that this person was not brought up with. Have you ever found out what really happened? Or will you say this person went there where she went or where he went and he joined bad groups, that's why he or she is like this? Please always find out if your son, your daughter, your relative, your brother, your sister went working somewhere and has come back home with such kind of behaviors that you don't tolerate in your society or your place of your social environment. Find out what happens. Traumatizing events are always an implication of some previous events that were not good. Ladies go to work away from an environment that they were not brought about. They become a source of income to some other people in a bad way. There is nothing they can do. They do the jobs that I've said, the jobs in quote, they cannot run away. What happens? They carry the trauma. When the contract and the visa is down, they go back home carrying the trauma. They start engaging in some things that they become irritable and you start feeling that what is happening. Now, don't judge this person. Sit down with this person so well, try to manage because this is poor coping mechanism. And how can we manage? How can we come and manage these people? Hmm? Prevention and management of secondary trauma. That is where we are now. How can we manage these people? Regular supervision and debriefing. Always be with this person, supervise calmly, try and help this person, brief this person. Here, when you came, when you went, you left us, we were doing ABCD like this and that. But this time, this is what we are doing. Don't be overreactive when this person is doing something wrong. You, as a sane person, understanding this person is carrying traumas, if you overreact, you will be opening the wound higher, much wider. Hmm? Overreacting to a person who has trauma, who has carried traumatizing events and they are affecting this person mentally, is like taking a knife, a sharp knife, and digging down to the stabbed wound, which is healing. Don't overreact. There is good ways of coming around and talking to this person. First, I've said supervision and debriefing, training and trauma-informed care. Very important. Take this person to a trauma-informed care where he can be talked to, hmm, on issues concerning the trauma event that happened specifically to the person. Setting emotional boundaries. Which are emotional boundaries? Overreacting is one of them because you see, overreacting at times makes the other person feel there is nothing that can happen. Hmm? I'm done and I was destroyed. We don't go that way. Yeah? Setting emotional boundaries means clearing, defining, and protecting your emotion space so that your feelings, needs, and mental well being are respected. You get it? By others. Help you separate your emotions from others, prevent emotion manipulation. Hmm? As you stop overreacting, don't allow manipulation from that person. You get it? Define how much emotional energy you give and receive in a relationship. You see, emotional boundaries. How much emotions are you trying as you help? Are you giving and how much are you receiving? You get it? This is what we call emotional boundaries because if you give, if you pour all emotions and you're trying to help fully, you may be taken advantage of. Hmm? Why emotional boundaries is so important is this: preserves your mental and emotional health, prevent burnout and resentment, promotes mutual respect and healthy relationships, help you avoiding absorb other people's negative or problems. Very important. The last one, which is help you avoid and absorbing other people negative or negativity or problems, is very important. You get it? Emotional boundaries. You get it? Very important. Don't be part of negative problems. Don't be part of trauma. Don't carry trauma from a person who is traumatized. The other one is practicing mindful and self care. Mindful and self care. Mindfulness. Be careful. Hmm? Build peer support. Have a support of peer group with you. Very important. Hmm? Coping and treatment. You see, it may be so bad and someone needs some treatment. What can you do when it's so bad and this person needs some treatment? That's where you come in with therapies and counseling, especially trauma focused. Hmm? Join support groups, practice self care routines, sleep, diet, and exercise. Very important. Hmm? Time off or workloads adjustment. Don't have a lot of workloads. Adjust sometimes to relieve yourself. Developing resilient skills like journaling and meditation. Meditation like yoga, dance, those are things that will help someone to relieve self. You get it? Hmm? We have really dealt with this problem. And now people know that you, where you are, you will know that rather than a person being traumatized personally, this thing can be carried to you who is trying to help. And as I speak like this, I know someone deeply inside that person as you listen, or someone who will listen will say, yes, this is me. Now you know how to handle issues about secondary or vicious trauma. You get it? Karen White, welcome to the platform. I see you, Karen White. We are talking about secondary trauma, handling problems from someone else. Hmm? Welcome, welcome. Now you know, as we try to help people, don't be part of it. Don't be part of you've given emotions until you are part of problems and you are suffering secondary trauma and then your mental health is becoming a problem. Hmm? You see, it is very important to separate other people's. Now, that is vicious secondary trauma. Welcome again. Don't be so sad. We are trying to help people that are with us, people that are helping us in life. And the song of the day I said is from a guy called Kidum, who said emotional trauma cannot be cured with painkillers or done a surgery to get away with. And I'll sing it again. Maumivu ya penzi mtu ajikuni wala jikandi na maji na hakuna upasuaji yeah. Let me continue now. Too much entertainment. Now we are at another topic that is so frustrating, a topic that is so nice, a topic that is soul food, but it becomes traumatic when it is not good food. You get it? Sexual traumas, sexual traumas, sexual traumas. What are sexual traumas? How people have gone to jail because of sexual traumas. You see, sex is a nice thing when it's done well at an appropriate age, and there are some words I'll not at this. There are some words I'll not speak them out. I'll give a sign language or a coded language because YouTube may take this video down. So when it comes to this, there are some things that we need to understand. Age, consent, very important. Mood, very important. That is very important. So what are sexual traumas? Refers to unwanted experience that causes significant psychological, emotional, and physical harm. It includes acts such as rape, sexual assault, molestation, coercion, harassment, or exploitation. These experiences can happen at any age, can have lasting effects on person's mental, emotional, and physical well-being. You see, there are some things that may be having mental effects, and I usually say that, and they become traumatic, and the effect will be exhibited physically. So today I'll introduce this topic. If we don't do the management, tomorrow is another day. We can do the management tomorrow. Yes. Sexual trauma is a psychological and emotional and physical aftermath of unwanted sexual acts. You see, after physical encounter, you carry now the disturbance. You get it? It includes experiences of force. Someone has been eyeing you for so long and now he comes and forces himself or herself in you. Coerced. If you don't do this, blackmail. I can do this, so you have to give me this cookie. Yes? Who you are taking the cookie? Are you feeling nice that the other person is not feeling nice? That is not correct. Very bad. Or violated sexually or violated sexually without the informed and voluntary consent. So any adult that has not given a consent, that is a sexual violence. It's bad. That is bad. This trauma can result from a single incident or repeated exposure over time. So someone can get one exposure and it becomes traumatizing the whole of the life. Or someone can receive it repeatedly. What I've said, forced, coerced, or manipulated, or violated. These ones commonly affect children, adolescents, and adults. You get it? Of any gender. And it involves violations of trust, bodily autonomy, and safety. leading to deep emotion wounds. Leading me to a question now, if someone gets into a marriage, this is for the public and everyone, because this person was not willing, but he went to a marriage with a person and she or he doesn't enjoy the sexual act. And sometimes it is done as forcefully. Who is to blame? This is a question that we will answer at the end of this topic. Is this a violence, or how can we categorize this? Is this a violence or is normal? Because now here we are being told you need consent. Yes, I need the cookie. I feel like jumping onto it. Then the other partner responds, right here it is. Come and pick it. You see, that is consent. But now this person got into a marriage unwillingly. But see, a marriage is funny. Sometimes people don't even give consent. You just jump into it and you continue. And then after some time, you get a partner suing someone. I was raped several times. And this person got into the marriage. Why? Because at the time of marrying, this person was vulnerable, maybe financially, or was avoiding something. So the marriage was the only thing. We will discuss about it. But what I really want to say about this, when it comes to children, I said in Kenya and most countries in Africa, when someone can only consent when he's 18 years and above, any person who is below 18 years has no consent over this act. So if you are a mature person, you have been doing this with the underage, courts will not take your word that I was consented. Keep it right. So any person that involves him or herself to this act with a young person, it may be taken as being taken advantage of. And this one can be traumatizing, because now if someone is underage and you are buying some things to this person, and one day when this person grows up, he realizes that this person was taking advantage of me because I was young, that is traumatic event. Because an exposure to an event at an adulthood will come out clearly that no, that person was a pervert and he was taking advantage of me. It is so important that we don't, if we find a person who is taking advantage of children, that is a legal issue. This person should be taken in court. Now, our time is going. We have like 5 minutes. We have like 5 minutes, and I want to say, as I finish, I know this. I will continue with this tomorrow. As I finish, if you have a question, you ask. You ask as we continue. As I finish, the type of sexual traumas that we will talk about are sexual assault, unwanted physical contact. That is an assault. And then we have rape, non-consensual penetration, the definition of rape. Sexual assault definition is an unwanted physical sexual contact. You know all of them, like kissing, grabbing, all sexual assault. Rape is non-consensual penetration. And then we have child abuse, child sexual abuse, involving children in sexual activity. So if you are a guardian, a parent, and poverty has led you to this, people that I've seen, I saw in the news that some people are sending your kids to an unwanted sexual activities, know that the law will find you. It is not correct. Sexual harassment, sexual advances and behaviors. You have a friend you are close to, and sometimes when you are talking, this person is always touching your boobs, your here and there, showing some. You see, that is sexual harassment. Speaking to a person in words that are romantic, and this person is not your person. Wanting to do PDA, public display of affection, and this person is not a person who is in a romantic relationship with you. That is sexual harassment because the other person is not okay with that. You are harassing this person because maybe this person is dating, maybe this person is a minor, and as you do that, this is a media technology era. This person will find him or herself on media, and or the media and the media generation and personalities of the media will start saying that you are cheating on. You see, hmm? Sexual coercion, sexual. These are things that we will talk about. Sexual coercion, pressuring someone into sexual activity. If you love me, you will do it using power or threats. Eh, let me ask: is loving someone who you're dating, showing it by sexual act? Can you be in a relationship without sexual act and you are both too okay? Let's think about it because that is another problem between couples. I've stayed for so long without sexual act. This person doesn't love me. What can we say about that? What do you think about that before we reach to that question? It's a very important question to middle-aged people that are getting married and just are just early in marriage. That is a very important question. I've seen people separate because of that thing. They are not making love, so he doesn't love me. What is love in a relationship? That is where what the question that we are asking ourselves here. What is love in a relationship? Hmm? Sexual exploitation. These are forms of sexual traumas. Sexual exploitation, manipulation or abuse for personal financing gain. You are trafficking young children, you are the madam in a hotel somewhere, and you are trafficking prostitutes. Said it. I didn't want to say that word, but it has just come. Very sad. That is exploitation. Maybe that person is doing it because of money, and that work is illegal. I don't know which state has legalized it, but where I am, it is illegal, and you are the one who is trafficking it. That is sexual exploitation in the gain of you having the money. Much worse when it comes to exploitation of children. We will see about that. Online sexual abuse, digital sexual harassment and exploitation, revenge porn, sextortion, grooming online. Those are the things that we will talk about from tomorrow. We have said sexual assault, rape, child abuse, child sexual abuse, sexual harassment, sexual coercion, sexual exploitation, online sexual abuse. We will talk about it tomorrow and we will see how to manage the victims that have come out of this, and we will know how our society can live better without these people that do this work. Because out there, there's some pervert who think the only way they can live is by exploiting people and the pedophiles. I will repeat, we talked about pedophiles somewhere. I will repeat it tomorrow. So, if there is no any other question in the platform, I've handled secondary traumas. Now everyone knows how to handle or to identify these people by character and behavior and cognitive function. A person, you can identify this person is having secondary trauma. We have dealt with it. Please, if you have a question, don't keep silent. Everyone has my email address. I've pinned it every time and I'm pinning it again here so that if you have a particular experience that you might like us to help, hmm? Okay. If you have a particular problem that you'd like, please, the email address is there. Pin it, send the message. Let's talk about these problems. Wherever you are, I can guide, we can guide, and we can help you. I've seen people that have helped people and they become the victims even after helping. If you have a question on how I can manage or we can help someone manage after helping someone, then you become a victim of torture and trauma, and you forget now your social life, you start having problems with your family and your social life, the email address is there. Explain to me. And as doctors, we are always confidential. And a warning is this: you try to bring any nonsense or jokes on mental health, my lawyer will deal with you as needed. You try to hack my account to get my email address or what, you'll be in problems. I deal with important issues and I deal with people that I help. I'm very serious with what I'm doing. These things that I'm talking about might seem not important to some people, or some people may try to bring some jokes around them, but I'm warning them. I'm covered by very important and powerful lawyers. So when I'm trying to help people through their traumas and mental health, please, I want any person, please don't bring any jokes. Let me help people live a good life in a good way. Be blessed. Have a good day. If there is no any other question, I thank everyone that has come to the platform. Let's meet tomorrow at the same time. We continue with sexual traumas and we see how we can help people that have these problems. Like, be blessed. See you guys. See you tomorrow. The same time, the same place. Love is my religion always. Bye.